Hello, my name is Rachelle Wood, and I am presenting a quantitative initiative to improve resident health and well-being while on inpatient medicine rotations. This project came about when a group of residents realized that all of us were feeling run down and sluggish, and then acknowledged that none of us were drinking very much water. Dehydration is known to negatively affect every system in the body and propagate lassitude and lack of mental clarity. A case-control study by Solomon Kirwan et al. Found that doctors were twice as likely as their patients to be dehydrated to the point of oliguria, and to a degree that gave them increased risk of acute kidney injury on 22% of measurement days. The United States National Academies of Science, Engineering, and Medicine recommend an optimal daily water intake of 125 ounces per day for the average adult male and 91 ounces per day for the average adult female. At project initiation, our group intake was less than 20 ounces per day. We approached this project using the 7-step A3 problem-solving tool and set a SMART aim of increasing each individual's daily water intake by 30%, from a baseline of less than 20 ounces per day to a minimum of 26 ounces per day, with a goal to sustain this increase for a minimum of 1 year. We used a fishbone diagram to drill down on the causes of our inadequate water intake, and then used a pick chart to narrow our focus to realistic, effective interventions, including increasing dehydration awareness, setting individual daily goals, utilizing reminder apps, and starting a group run chart to track and encourage our progress. At project completion, we discovered that we had met our goal with an increase of 47% for an average individual intake of 28.8 ounces per day. Participants did report increased urine output, but had not qualitatively noted clear or sustained decreases in fatigue or increases in mental clarity. As shown in the run chart, raising awareness, setting goals, and initiating tracking were enough to cause a small increase in daily intake that was maintained throughout the project as opposed to continuous improvements. Although our specific goal was achieved, daily water intake remained well below the recommended values for all participants, and there was no measurable improvement in participant well-being. To address this, future goals will be set to achieve optimal intake and are expected to provide more benefit. We acknowledge that increased access to water and restrooms will promote further success and have requested these changes.